I'm here.
I don't mind being your friend, but
We are.
but if you do need something, you just look at me. Do this. You're on my own. You get it.
Yeah, that's
Good work. Thank It's my new perk.
He's got something else.
Sorry to meet you. Whatever you need to say.
Good afternoon. The House Committee on Children and Families will get underway. We have 4 bills to hear today. Thank you all for attending. I hope you had a good Easter break. Our first sponsor is Representative Berry with House Bill 1268. You may proceed. Oh, I'm sorry. Wait, we got to call the roll. I'm under the gun. I'm like, come on, we got to go.
Chair Franklin? Here. Vice Chair Neely?
Here.
Meredith? Here. Beard?
Here.
Bratton? Brown? Here. Gannon? Haefner? Here. Flower? Here. Newman? Knorr?
Here.
Brimley?
We have 7 present, so we have a quorum.
Thank you, Madam Chair.
Proceed.
For the record, TJ Berry, District 38, representing the communities of Liberty, Kearney, and Excelsior Springs. I'm here today to present House Bill 1268. It is the Early Childhood Health and Education Act. Its purpose is to provide coordinated funding for early childhood health and education programs. Early childhood, in this case, is defined as pre-K. The early childhood health and education councils will be formed, and each county, they may elect to join a regional district. The council will consist of 9 members, a parent of a child under 5, a child care provider, a health service provider, a public school administrator, an early childhood educator, 1 member of the business community, 1 representative of the faith community, 1 philanthropist or his member, and 1 member of the ag community. So what we're doing here is creating the structure of these boards, these governing councils, to help provide services. And the services that are going to be provided or are improving the quality of early childhood development and health programs, increasing the access to quality early childhood development, increasing the access to preventative health with screenings, offering parent and family support and education, providing some professional development and training, and increasing the coordination of early childhood development and health programs. This is a very broad but specific act. What we're trying to do is put together the correct governing process so that if a cigarette tax would take place and be increased, that the money would flow down to these governing boards. So what we're starting with is, what would that governing process look like? What would it be made up of? And how would we go about, how would it be governed? So that is what the act is doing. I'm happy to answer questions, and I know that I have some testimony.
So to fund the services, to fund the structure, putting everything together, it is right now dependent on an increase in the cigarette tax?
It is. Okay, you will have an amendment. If we can get all the parties that would be involved in that tax increase to come up with a funding level that they would not argue over, then there will be an amendment that would be placed on the bill, and we would go forward.
Curiosity, can we raise that cigarette tax as a body, or does that have to go?
No, it would go.
The people?
It would go in front of the vote of the people.
Committee members, are there any questions of the sponsor? Representative Hager.
Park.
You may.
Just quickly, how do you envision this working with current programs that we have, such as Parents as Teachers, and I know there's another one for kids that are younger than that?
It would be separate from them, and it would be these governing bodies would have a designated revenue source.
So this is another program for that age group?
Yes, much more extensive than Parents as Teachers.
Do you see it as replacing Parents as Teachers, since they're doing a lot of the same function?
No, I really don't see it replacing Parents as Teachers.
Thank you.
Representative Neely.
Inquiry, please.
You may.
I see in the bill on paragraph 8, there's a statement about the council may contract with a third-party grant administrator to meet the requirements of this section. That's probably in my mind, as I sit here and ponder this, a key issue is that this person I heard the term yesterday in a council or a commission meeting about we have these silos of institutions, whether it's corrections and social services, et cetera, and there's no cross-pollination, or meaning no communication to create a good product. Lack of communication, and so would that be something that probably would be the key issue here? Is it getting a person to coordinate all of that?
You know, yes, that could be an issue. The way it's set up is you are allowed to do it as a county, okay? Or you can gather together in a regional basis, sort of like in our region for roads and so forth, we gather together with Mark. so that you would get a broader view and a broader help for the entire region, and a little bit deeper bench for administrating the program.
Thank you.
Representative Meredith?
Issue to inquire. Kind of along the same line as Representative Neely was talking about, one of the things that I hear over and over again is to get government out of our lives and not have government be so deep in our personal lives. As someone who works with foster children, one of the complaints, I guess it's a complaint, that I get a lot is there are an awful lot of people trying to help this one child. There's, like with foster children, there's their children's division worker, there's their guardian ad litem, there's the deputy juvenile officer, and the list goes on.
Sure.
And what I'm thinking is, we're talking here about very young children, and if we can get people to participate, as we have in the past, then parents as teachers. It seems like these two should work in conjunction because they're kind of, the goal is the same, to make sure that these young children get a good start in life.
Absolutely.
So maybe it could be the same people actually providing the services to the families or something, some way to, like you said, connect the silos.
Absolutely. I understand what you're saying.
Representative Lauer?
To inquire, Madam Chair. Thank you. Thank you, Representative, for being here. We could just kind of dial back and talk about what's the trigger or pain that's causing this to be needed. What's not happening, or what is happening that's causing us to have to create another level here?
You know, our funding for early childhood is not what it should be. Okay, and the wraparound services, especially for children in need, we're not meeting them. Okay, so how do we come together and create the dedicated funding stream to meet those needs? Okay, and that's the piece that you're not really seeing in the bill, but you have to have the structure first and then the mechanism, and that's where we're at.
So is it that the funds are, well, A, there's not enough funds, and B, is it that they're being distributed in appropriate fashion, or is it that they're?
I don't believe that it's an inappropriate fashion, but Representative, I think that you and I both know that when we look at the funding and look at where we put our emphasis and our importance, it's very easy and for us to take from education funds. It's a very large fund. But the studies have been very, very clear that if we focus on education at the early stage, that we have a bigger bang for our buck. And so that's what we're looking at here.
And I certainly don't disagree with the intent of helping young children. I mean, I can probably agree with that. It's just the mechanism that we're using to get there. So I guess in looking at the process of what's not working, that's more where my question is. And what in the process is not working that's causing us to have to put this coordinating for?
So sure. So if you look at this in the totality, okay, and let's say that we did increase the cigarette tax and it came into general revenue. Where would that revenue then go to? It'd go everywhere and anywhere. Okay. And by setting up some very specific guidelines of where we want the money to go to and a stable funding stream, then we can start to do longer term planning and putting together a program that you're not afraid of every single revenue cycle that you're not going to be able to continue.
Thank you, sir. Thank you, Madam Chair.
Other questions? Representative Brown?
To inquire.
You may.
Okay, I heard the one representative mention parents as teachers, but we also have preschools. We have preschools that are nonprofits, preschools that are private, preschools that are run by the school district. Okay, so we have all of those. Do those all fall under this umbrella?
It could, okay, but there are a lot of other services in healthcare and education. It's not a one specific thing that you're going to be providing the money into. That's why the governing councils will have a little bit more local control, looking at what is your situation in St. Louis County, what is your situation in Adair County, and seeing how you want to best help your community. Because the idea is local control. You know what's going on in your community better than anybody else.
Do we have to worry about the problem that if you get this funding stream and it comes there, now the existing funding streams that they get go away?
The existing funding streams for most of those things are coming out of general revenue. They're not coming out of a dedicated funding system. Okay, so it's a two. Could we as legislators then move money and take away from there? Sure we could. That's well within our.
That is what we've seen in the past. That's what I'm mentioning it for that reason. Sure. Need to address that.
Okay, thank you.
Thank you.
All right, Representative Berry, how many witnesses do you have?
At least two.
You know, two that can speak and maybe answer some of the questions in addition that the committee has. Let's go ahead and move to those then.
Thank you, Madam Chair. Erin Brower, I'm representing the Alliance for Childhood Education, and also Raise Your Hand for Kids. Just a little background of how this bill came to be today. Between November and January of this past year, we traveled the state, hit 13 different communities throughout Missouri, and we were talking about those communities' needs around early childhood health and education for children ages birth. They love their early Head Start programs. They love pre-K, but the problem is the lack of resources. So we really discussed how we could develop a policy that fits all of Missouri's needs, and we all know how diverse Missouri is. Some communities have been hitting the ground running with early childhood programs. Other communities are starting from the very bottom. So we wanted to create something that was really flexible, accountable, and that could work for all of Missouri, and that's what we have come with forward with this bill today, setting up this early childhood structure. And what it does really is gives a lot of flexibility to the local counties. You brought up, Representative Brown, the issue of potential fund swapping in Jeff City is a big concern with folks throughout the state. The bad good thing is we're really not funding early childhood to begin with. We funded about $37.5 million a year. Of course, we want to protect what we have, but the idea of we could be fund swapping, I mean, it's not there. Another concern how we got over that hurdle is we would like these dollars to go straight to block grants to counties. And these are the issues we discussed during our community conversations. What's going to make you feel, have trust in this policy? What's fair? And from what we heard time and time again is we'd like to see block grants to counties based on the per capita birth to 5 children in that county. That really gives every county their fair share. There's a big concern, all the money goes to Kansas City and St. Louis. This gets over that hurdle. We were able to go into the counties and show them, look, on your population birth to 5, if we were to raise the tobacco tax 50 cents, this is how much money we could bring into your county, and you can start planning for this. We heard a lot about transparency and accountability. We heard the needs of, we love parents as teachers. Can we put this money into our parents as teachers program? Absolutely. The governing board is going to be in charge of deciding what those local community needs are. They are the best ones to know what private providers are the best for their county, what public pre-K is best. Not every county has a public pre-K. Not every county has a great private provider. This allows the counties, that governing board, the flexibility to fund what they know their county needs to improve quality, to improve access. We heard in Columbia has some great pre-K seats open. Their issue is transportation. It's really expensive to transport kids ages 3 and 4 in a bus because buses need seatbelts. They asked, can this money be used for transportation? Yes. It's up to that governing board to decide how they want to spend that money within certain parameters of birth to 5, early health screenings, that's for hearing, vision, dental, behavioral, and your early education piece. Your home visitation, like parents as teachers, evidence-based programs. St. Louis has a great program called Nurses for Newborns. I wish it was throughout the state. We don't have the resources to fund it. This could fund those programs. Preschool, private, public, faith-based. I mean, we have a lot of options here Like I said before, not every county has public pre-K. Again, pre-K is not going to fill every family's needs either. Family need childcare sometimes 7 days a week before and after school begins. So we really see this bill as allowing great public-private partnerships, really leveraging those resources and making these programs work for each individual county. We see a lot of innovation and a lot of, we're really excited about where this policy can go. It was modeled after something they've been doing in Arizona. I've been working pretty closely with folks there, talking about, what would you change differently? What are the mistakes? What's going on? And so we put a lot of work into this. It's about 1.5 years in the making of developing this policy. Like Representative Berry said, we are working with the tobacco companies and convenience stores to hopefully come to some language where we can agree about a funding source, something that's reasonable, that voters will be comfortable increasing the tobacco tax to fund early childhood health and education. But from all the conversations we've had, it's something that the communities really want. And again, writing this policy, we went back and shared it with those exact communities we talked with in the first place. We wanted a very inclusive process to make sure this policy works for all Missourians, especially for our kids.
Any members, do you have questions or comments? Representative Neely.
One question, please. Inquiry. You've mentioned nurses for newborns. Who operates that program?
So that's a program it's called Nurses for Newborns in St. Louis. And I know it's evidence-based, and when we went to Kirksville to talk about it, Rebecca McClanahan, who's the head of the Nurses Association, was there and said, I want to bring this program to Kirksville. I just need the resources for it. So it's another great program that unfortunately it hasn't made its way around the state due to lack of funding.
The reason I ask is that what does the health department do?
Well, health departments were all invited to our community conversations as well. We had business leaders, superintendents, health departments, really trying to talk about coordinating those wraparound services. Some health departments are offering health screenings already. Some early Head Starts are offering health screenings. How can we combine these efforts, stretch these dollars so they go far, but also make wise investments? So we're coordinating with all the stakeholders involved in this. And again, that governing board, like Representative Berry listed, will have representation from your health, from your education, from your private, from your public, from the business sector. So really we can reach, everyone we need to reach.
All right. I don't see any other comments or questions for this witness. Be sure to fill out a witness form.
And thank you for your time.
We have 3 other bills to hear, so I certainly want to have your witnesses. What I would need now from our witnesses that are in favor of the bill to certainly limit their testimony to 2 minutes and try not to, bring out something perhaps that has not been spoken to previously. All right? So I'm ready for another witness to speak in favor. Is there anyone else? Yes, Judy. Thank you. I wasn't sure whether you were just going to pass something out or.
Sorry, I was trying to hurry. So,
yeah.
Judy Duncan with the Missouri Children's Leadership Council. Thank you, Madam Chairman, members of the committee. Thank you, Representative Berry, for bringing this bill. And I will be very brief. I gave the members of the committee an article that appeared in Forbes magazine last week, and every study shows the verdict has been in for a while that early childhood education is really, really important to business owners and to our economy. It really is the leadoff hitter. I'm a big baseball fan. It's really the leadoff hitter in a child's life. Missouri is kind of playing at the edges. There are some programs, but we rank 38th in terms of funding that we provide early childhood education. And I know everyone would like to do more. This is a great solution. It's not it's a state-funded solution. It's not a federal expansion of programs here and all the requirements that come with that. That's not part of this. It's locally controlled. I think that's been said. If you would take a look at this Forbes article, I think it really says everything that I would like to say. Kids that have these resources graduate from high school, they go to college, they raise their own kids. I mean, every study is showing the benefits of this. So I think I'm in under 2 minutes, and I appreciate
that. I don't see any questions from the committee. Thank you. Please leave a witness form. Others in support?
Gamble, City of Kansas City. The city would like to go on record in support of one of our local representatives' fine pieces of legislation. Mayor James, Mayor of the city, early childhood education has always been, it has been and continues to be one of his top priorities, as is education and getting kids to read and hearing a variety of words, which is surprising how many kids in some of our challenging areas of the state haven't heard the written word or haven't even really read as much as they should. So this is one of his priorities. We appreciate you hearing this piece of legislation.
So any questions from the committee? No. All right, thank you. Others in support? All right. I don't see any. Those in opposition. Is there anyone here in opposition to the bill? Those, I don't see anyone. So anyone for informational purposes only? Do you have any closing comments?
Thank you very much.
All right, you're welcome. Thank you. So that ends the hearing on 1268. Let's see here. We'll go to Representative Morris next with House Bill 1090.
Good afternoon, Madam Chair. Good afternoon, Madam Chair and committee. Thank you for allowing me to present this bill. I'm Representative Glenn Morris, District 140, Eastern Christian County. This bill, House Bill 1090, is a bill that I heard from a group of home care agencies that we need to try to help them correct a bill, that a law that has already been passed that's going to cause a problem come this July. The current law requires personal care assistants to implement a telephony system of recording hours and services by July 2015. This bill would extend the deadline, giving companies additional time to evaluate the usefulness and implementation of mandatory telephony. In 2010, the legislature passed reform legislation, several components of which were directed at the in-home industry, both traditional in-home and consumer-directed care services. The legislation contains several components. The reason why I believe back in 2010, if you all will remember, on national news all across America, we had a lot of fraud going on, especially in California and California and Florida. A lot of home medical agencies, home care agencies, different types of medical fraud going on. And I think that the home care agencies here in this state was trying to prove that they didn't have a problem and making sure they didn't have it, protecting their image. But at the same time, this bill now is going to affect all these home care agencies. I've got 3 witnesses today, and you're going to find out that only about 10 or 11% of the home care agencies are signed up to do this. It's expensive to buy the software, and then it's expensive to use the telephone system as it goes forward. So, you know, I know we've got limited time. I think that I'll just go ahead and let the witnesses, and I'll see if you all have any questions. But what we're trying to do very quickly is change the implementation date from 2015 to 2017. What we're going to do in 2016 is use that 1 year as a study time to evaluate. And on the last page, which is page 5 of the bill that you have, it's just going to certain effectiveness of utilizing an EBV system to reduce fraud and abuse of the Missouri Health Net program. Department of Health and Senior Services, Department of Social Services, and the Office of Administration shall have a report of findings to the General Assembly and Governor no later than June 30th, 2016. If such report of findings does not verify a reduction in fraud and abuse of the Missouri Health Net utilization of the EBV system, the requirement for an EBV system to be used by vendors or providers shall no longer be in effect. I think what we found and what you're going to hear from witnesses is, so far, the audits that they've had on home care agencies that's using the system as compared to ones that are not, there's no difference in the findings. They're not finding fraud on the ones that's not doing it any more than they are with the ones that are doing it. So if it's a financial mandate that's going to really hurt a lot of these medium-sized to small home care agencies, we're just trying to save them. So we'll let the witnesses ask any questions.
Are there any questions at this point from the committee? All right, please bring your first witness.
Okay.
Just about lost you. I'm not sure you're still with us. We're gonna have to work on that.
I'm sitting at the children's table. Pardon me, my name is Scott Penman. I represent the Missouri Council for In-Home Services. We're a statewide association of in-home providers, large to small, nonprofits and for-profit organizations all participate in our association. I personally and our organization was involved when this legislation was initially passed back several years ago. It was Senate Bill 1007. Representative Sater had the original bill. Representative Dempsey ultimately passed the legislation. Essentially what we did at that point was industry said, you're asking us to look at an unfunded cost increase, so a mandate on how exactly we keep track of our employees. And that's what telephony does. Nothing really more, not a whole lot less. If we're going to agree to that for the two purposes stated, were one, fraud prevention, and two, cost savings, then we'd like to evaluate that. If it proves out that indeed does save the state money or catches more fraud, we will, as an industry, support the implementation of the program statewide mandated. Pilot project mentioned hasn't proved either one of those. In fact, there's some argument you can make that it proves the opposite. It simply increased costs, and it doesn't actually give us better accounting or any fraud prevention. So we, I think ultimately would like to see the mandate not be affected, but recognizing that there may be a need for some additional accountability. Representative Morris's legislation pushing off that deadline for a couple more years so we can address some of those questions about technology through a better study we're very supportive of. The other parts of this legislation I think seem minor, but they're very, very significant. The law says you have to use a telephone-based system. And in fact, it also allows, in fact, a lot of the newer technology and perhaps even the cheaper technologies and better technologies are not telephone-based. They'd be either GPS or other kind of check-in types of systems. But the statute says, well, you can use, the department can authorize other types of stuff, but as long as it meets the requirements of subsection 1 of the statute. Well, subsection 1 of the statute says it has to be telephone-based. Somebody wasn't paying enough attention when they were working on that bill a few years ago, and that creates a quagmire. Now, the Department of Health and Senior Services said, hey, we understand that, but we still have the authority to authorize it, so we'll allow for alternative technologies. Well, in our world, there's two very important folks. Department of Health and Senior Services, they authorize their services. Department of Social Services, they pay. The folks who do the auditing, MMAC, and they do the auditing and check in payments, they have not said, sure, use something that's not telephone-based. The department that authorizes has. In my world, in this world, we have seen places at times where the two departments haven't been able to come into agreement, and it's created huge fiscal liability for providers who have in good faith been, going on a department's recommendation, and that department gave it to us in good faith. But then we end up later being told, oh, you actually have a huge liability. You're going to have to pay us back. You can't continue this policy. We've had this happen in the last 9 months on background checks with the Highway Patrol. So it's not just a fanciful issue. This is a very real issue that could create huge liability for the providers out there. I know that for larger providers, telephony is probably a smart cost for business. If you're large enough to not need that back office person, you can push that all to an automated system, that probably makes a lot of sense. The vast majority of our providers in the state, they're taking care of our consumers in their homes, elderly and disabled. They're not really big folks. They're smaller, mom and pop, community-based providers. And this is a huge cost burden for them. And we're also, just to be very clear, we're facing budget cuts again, potential rate cuts again. And this industry is trying its best to care for our most vulnerable. And instead of wasting our money on a system that doesn't help prevent fraud, we'd like to spend that money on caring for the seniors. Be happy to try and answer any questions from down here.
Representative Haefner, you may.
Good afternoon. I'm just curious if this definition of EVV would include the GPS or the
FOB systems?
The following systems. I know a lot of delivery services use the GPS or the follow me phones. My husband knows where I am every minute of every day because of this little thing on both of our phones. is that allowed under this?
Under the new, under Representative Morris's language, the answer would be yes. And in fact, the EVV, that electronic visit verification language, is really what's developing all kinds of places. And very specific examples are places where you don't have cell coverage, or the consumer doesn't have a phone. You now can't follow the law. So we need to be able to use a fob or a GPS. And this language, the intent is that it is broad enough to incorporate those emerging technologies and whatever is next.
Okay, thank you.
Thank you, Lynn.
Other questions? No. Oh, I don't see any. All right, thank you. Be sure to leave a witness.
Yes, ma'am, thank you.
All right, we're back to our 2-minute testimony time. So yes, thank you. 2 minutes.
I stick to my script and read very fast.
Please, well, I don't want you to feel, really pressured, but you don't need to tell us anything we've already heard. So that may help you, but we're pleased to have you.
Thank you for having me. I'm Susan Harrelson. I co-own a Medicaid-based home care businesses with 12 offices in rural Missouri. Proud to say that Premier Home Health Care has been in business run by myself and my business partner for only almost 23 years. We tried telephony about 9 years ago, and unfortunately it was a total disaster. Here's why. Clients don't like us using their personal phones. It's their phones. They are Medicaid clients with little money and sometimes just have so many minutes per month on their phone. If a client is on the phone when we walk in, then we have to wait until they're off the phone to even clock in. Sometimes we're sitting there for a half an hour. We don't want to tell them to get off their phone so we can clock in. Oftentimes there is no cell phone signals, like Scott said, at our client's home to clock in with telephony anyway, so we're back to paperwork, square one. And as most of you know, most people do not have landlines anymore. The initial cost of telephony software is astronomical. The ongoing cost of telephony is, to me, outrageous. Software for my company is estimated to be between $10,000 and $30,000. I'm a mid-sized home care company. The cost of training all employees to use the program, I can't even estimate. The ongoing cost of telephony each year is going to average 50 cents to clock in, 50 cents to clock out, and for my company, it's going to cost me about $100,000 a year. It does not prevent fraud and abuse. Scott referred to a study completed a few years ago and turned into MMAC. There is no evidence that telephony helped to deter any fraud or abuse. All it does for medium or smaller sized home care businesses is put them out of business. There's some very large home care companies that are Medicare and Medicaid based that have been using telephony, like Scott said, for several years, and it works for them. Currently, there are about a third to a half of all home care agencies in Missouri that have not instituted telephony. Apparently, Scott knows that there's probably more than that. The reason is does not prevent fraud and abuse like originally intended. Plus, the cost is prohibitive to most companies. I'm sure that you're all aware that home care companies will have to deal with some major issues in the federal wage and hour laws coming July 1st. Also, smaller companies will have to make healthcare insurance affordable to their employees next year, with 50 employees and below next year because of the Affordable Care Act. Add the cost of telephony to these companies, and many of our Medicaid-based home care companies will simply be out of business. Let's find a better solution that will work for home care, that will actually prevent fraud and abuse, and will be affordable to small business owners. Remember, telephony does not prevent fraud and abuse, I can't say that enough, which is the very reason for the bill in the first place. The cost is substantial and will be detrimental to many. Please consider this addendum to put telephony off for 2 years and find a more affordable solution. Thank you.
Thank you. I don't see any questions. Thank you. Be sure to leave your witness form. How are you?
Fine, thank you. Appreciate being here. My name is Mary Shantz. I'm the Executive Director of the Missouri Alliance for Home Care, representing about 300 home care providers, 110 of which are in-home and consumer-directed service providers who are mandated by this bill. I wanted to echo everything that Scott said, but I wanted to bring up a couple of other additional pieces of information. I asked for the department to give me information on the number of providers that are under this mandate. If you take out those that do both programs, we're looking at approximately 690 home care providers around the state of Missouri. And although this information is about 3 weeks old, 3 weeks ago the information I got is that only 72 of them, which is just over 10%, actually have a working telephony system today. So we have, 4 months from now, or even actually less, July 1st, a mandate is going to go into effect that, as Susan indicated, can cost a significant amount of money, and only 10% of the industry is prepared for it. In addition, and Scott alluded to it, many of these providers are very small businesses. When you look at the volume of Medicaid billing that they do, which is really the only way we could get an estimate of size, when you look at that, 52% of the CDS vendors, and CDS stands for Consumer Directed Services, bill under $100,000 in fiscal year 2014. That's $100,000 is a lot of money, but it's really very small. And 81% of these same consumer directed vendors billed under $1 million. So we're talking about very small providers, many of whom are minority and women-owned businesses. It's a business that is open for without a huge investment. So we have a lot of minority and women-owned businesses that are in here. There are a couple of issues in the bill that we're going to work with a representative on. The language on the first page on line 9 that says that refusal to allow personal care attendant use of his or her phone is grounds for termination. We've been told by the department that the federal government, this is a Medicaid program, so these are people that are being funded through Medicaid, and Medicaid will not allow that kind of termination. It's not grounds for termination in the Medicaid program, and at the time that the bill was drafted, I don't think that was completely understood. So we would probably see that would come out. I believe the department is putting that in their recommendations to the committee. And in one place on page 2, on line 48, accidentally, the word client was transferred to the Consumer Directed Services Program, and it's actually a consumer, not a client. So just a minor changes which we'll work with the sponsor on. We very much support the delay of this implementation of this bill. Clearly, the fraud and abuse portion of the original legislation has not been approved. This delay will give an opportunity for the department to see if it is, if it does come to pass.
Thank you. Thank you very much. I see another in support. How are you?
That chair is low.
I'm sorry.
No,
You know, you can swap that out with
No,
the
it's
chair.
more than fine. We can all laugh about it.
Well, you know, you're under enough pressure there without having to feel awkward.
Well, thank you, Chairwoman Franklin and honored legislators. I appreciate the time to testify today. I'm going to make it real brief. I have written testimony, which I'll also read for you. My name is Kevin Gadsby. I'm the new Government Affairs Coordinator for Paraquad, one of the oldest infant living centers in the nation. And we're proud to represent St. Louis. Just wanted to draw out that we, since 2010, we have invested more than $100,000 in telephony contracts, but we've actually found it to be less effective than paper timekeeping. In a recent pay period of 293 attendants using telephony, we still had to process 44 entry errors using backup paper timekeeping systems. We support everything that's been said by the previous testifiers today. And with that, are there any questions that you have?
Do you have any questions? You did a very good job. Thank you so much. Be sure to leave a witness form. Others in support? Are there others in support? All right, thank you. Is there anyone here in opposition?
Yeah, we'll make him. We're gonna get you a good check. You know you're against.
Better? Oh, yeah.
Better.
So confident? Down there?
Madam Chairman, members of the committee, Jim Moody, representing Integrity Home Care, Springfield, one of the early adopters, I think, of telephony. Basically, the company that I work for has done it since their inception. And I'm going to use a different term than fraud and abuse. I'm going to use overbilling. Okay? And think about this. In the in-home services, we bill in 15-minute increments. Okay? And the appropriation is $800 million, roughly. So let's just, for round purposes, say 175 million 15-minute increments. What do you think the odds are that some of those 175 million 15-minute increments were not delivered? 175 million units of service. And basically our workers, when they clock in, what they clock in, that's what they get paid for. That's also what the state gets billed for. Anecdotally, one of my contacts at Integrity tells me that if you look at paper systems, everything's on the round numbers, 8 to 12. Everybody showed up on time. They left at exactly the right time, and there was never any slippage. And again, just let's assume that telephony stops 1% overbilling. Well, that would be 1.5 million units. Or, I'm sorry, 1.75, using that example. 1.75 million if there's 175 million units. And we just think it's a basic protect the public integrity of the program. Again, we pay our employees based upon them clocking in and clocking out. And in terms of the 5-year delay from when this was originally passed, that wasn't our idea. We thought it should have been required immediately. Some of the folks who are testifying this that needs to be delayed requested the 5-year delay, which has already happened. And so we think it's a basic matter of program integrity and that telephony should be required. We would support some of the changes in terms of electronic visit verification, I think it's being called, that would allow other forms of, other than telephony. But if the cost of doing that is to have an extension, we would not support that.
All right. Thank you very much. Are there questions? Representative Lauer.
To inquire, Madam Chair?
You may.
Okay, thank you. I remember this legislation from several years ago when we were talking about it. And as I recall, there was discussion then about some organizations already had implemented before the legislation.
We would have had it at that time, yes.
Okay, so there's no cost to you at this point to implement it, but if it were, I would imagine it'd be a pretty significant cost.
We have always paid for it out of the rate we are paid. And we think that if that's a cost of doing business, that it's money well spent. So when we do it, we're not getting paid more than anyone else. And we're able to do it. And again, we started this when we were a small company. We're a big company now, but we started this long ago when we were a small company.
So you've had this implemented then before the original legislation?
Yes, yes, we did. Yes.
And clarify for me, was there a level of reimbursement that went on at that point in putting this into place?
No.
There was no reimbursement received for this?
It's possible, again, this would have been in 2010, and my recollection is that was the no rate increase time. I'm doing that from memory, but I don't think there was a rate increase in 2010 because that was right after the recession. As a matter of fact, I think in 2009 or 2010, we took a rate cut.
Thank you, Madam Chair. Thanks.
So I have a question then. So in your organization where you do use this, what have been the results? Have you found that there has been some overbilling or that there's fraud or abuse or overbilling, whatever you want to call it? What have you all seen? What are the results?
Well, if one of our workers does not clock in, they do not get paid. And again, if they clock in at 8:05, they get paid from 8:05, and the state gets billed from 8:05. And so with telephony and with my clients, I believe this is fair to say, you are getting what you pay for. Whereas someone with a paper timesheet and they show up at 8:20, say they got there at 8, you're getting overbilled.
Thank you. Representative Neely?
Mary?
Yes.
What's the turnover like in your business?
It's fairly large. It's above minimum wage industry. Typically, we would be paying our workers above minimum wage, but depending upon their length of time with us, etc., it may be more in the $9 an hour range, $9.50. And it's inherent, when you're in that labor market, you're going to have some turnover. And again, they're typically taking care of elderly and disabled people with significant needs in their own home.
All right.
Thank you, Madam Chair.
Thank you very much. Those others in opposition?
One in opposition. Anybody for informational purposes? This concludes the hearing. Thank you. Yes, sir.
I'd like to just make one more comment. I appreciate you hearing the bill. Starting in July of 2015, for the facilities, the businesses that already have this telephony system, they're going to get an enhanced. My bill is a fair bill because this will give them a increased reimbursement starting July for 12 months. Okay, while we're doing this study. The other thing too, I'd like to point out is I'm confident that all these home care agencies throughout the state of Missouri, if they are doing a paper system, they're having someone sign that they were there at a certain time and they left at a certain time. And I'm sure if the times weren't correct, that some of these patients are sharp enough to tell. In my business, that people know when they start taking a different color tablet or a different time, or if you missed a dose or whatever. So I feel like these patients can help the facilities. And social services in the different departments say there is no difference. So appreciate you hearing this bill today. Thank you.
Thank you, Representative Morris. This concludes the hearing on House Bill 1090. Next, we'll move forward with Representative Dorman. House Bill 1111. Proceed when ready.
Thank you, Mr. Chairman and committee members. House Bill 1111 is really an issue of local control. We've had some rules come down from Washington that said basically fundraisers that involve items outside of the approved nutritional list that has come out in recent years can be sold only a certain amount of times during the year. So basically you can have bake sales when approved by the school. The school was given guidelines by DESE that said this would be limited to 5 times a year. The federal rule says they can do it up to 30. I see no reason that they can't do it up to 30. I think in this case, Jefferson City is acting a little like Washington, D.C. So I would just like to open it on up to the full 30 allowed by the federal government and let local schools decide if they want to have 30 or 5 or somewhere in between or none. And that's the essence of the bill.
Excellent. Any questions from the committee? If not, anyone to speak on behalf of the legislation?
Mr. Chairman, I do have some written. She was not able to be here today, but I think the committee has copies of that.
We do. Anyone else to speak in favor? If not, anyone speak in opposition? Anyone here for informational purposes? If not, we'll conclude this hearing on House Bill 1111, and we'll move forward with we have the House Bill. Representative Eggleston, House Bill 977. Proceed when ready.
Good afternoon, everyone. I am Jay Eggleston, State Representative for District 2, here to present House Bill 977, which addresses the use of EBT cards in ATMs to acquire cash. There are some in our state, in this building, maybe even in this room, that believe the government
has no business being in the charity business. They believe that charity should be left up to charities, 501c3s, church groups, civic organizations who can meet with and help those in need on a one-on-one basis. There are others in the state, in this building, perhaps in this room, who believe just the opposite, that they believe that the forced charity is the prime purpose of government, and that it's government's duty to take from those who work and give to those who are in need. Regardless of where you may stand on this seemingly eternal debate, I believe you will like House Bill 977, for this bill respects both the hard work of those Missourians that we tax to acquire revenue, and at the same time helps to ensure that we have enough to help those that need it, in part by realizing that there is only so much money to go around, and it needs to be used wisely to achieve the main objective of getting those in need back to self-sufficiency. Background information: in the early days of welfare programs, the government would issue paper welfare checks. Those are now electronic and known as TANF, or temporary assistance for needy families. The government also used to issue paper food stamps used strictly for buying food. Those are now also electronic and known as SNAP. A recipient's TANF and or SNAP funds are stored in an electronic account, can be accessed by the recipient via an electronic benefits card, or EBT card. An EBT card looks and acts much like a debit card that you might use to access funds in your checking or savings account. SNAP benefits are to be used strictly for food. TANF benefits are primarily for non-food items like clothes and toilet paper and diapers. There are specific laws already in place that disallow a TANF recipient from using TANF to buy vice-type products such as liquor, and tobacco, and lotto tickets. But as an artifact of how EBT cards are similar to debit cards, just as you can put a debit card in an ATM to withdraw cash, you can do the same with an EBT card. In other words, you can't use your EBT card to buy a fifth of whiskey, but you can put your EBT card in an ATM, withdraw cash, and then go buy a fifth of whiskey, or lotto tickets, or meth, or crack, or prostitutes, or whatever you might want to do. This is a clear and obvious opening for fraud and waste and abuse that is an insult to both the working Missourians whose tax money pay for these programs and to those in need who rely on there being enough money to fund these programs so they can use that money in the right way for the right reasons to pull themselves out of poverty and get back to self-sufficiency. So what 977 does is to make it not possible to use an EBT card in an ATM or any cashback scenario. Now, both SNAP and TANF funds, if this bill passes, can still be used to purchase all the items that a recipient may need. They just can't get cash back. This bill also clarifies the definition of tobacco as an item on the can't buy list, and it adds pornography as a specific item on the can't buy list. And then we have an amendment to this bill as well, Madam Chair, that's, I believe, been distributed, and that would reduce the punishment that we'd originally put in there for abuse of SNAP. There are some federal regulations already in place for that, and it clarifies the definition of pornography, and it corrects a clerical error in the draft. I have distributed also a testimony of someone that is a manager at a convenience store who firsthand, he couldn't be here today at a long distance to travel, but has firsthand knowledge of specific events, just in case you think that this really doesn't happen. It most certainly does. And with that, I thank the committee for your time and would be happy to answer any questions if there are any.
Yes, Representative Lauer.
To inquire, Madam Chair. Thank you. Representative, I just want to clarify what you were just talking about, the convenience store issues.
Mm-hmm.
And I'm just not familiar. Can you use these cards in convenience stores and every place else for the prescribed things, the food, the milk, and the butter, and bread, or are there any locations where they're not accepted that might contain foods or the appropriate things that could be purchased?
Appropriate things, probably not. There's, in current law, it prohibits the use of the cards in, I believe the wording was establishments whose purpose is to entertain those 18 and older, so strip joints and.
I'm talking bread and milk.
But bread and milk, no. As far as I know, no. That is up to the vendor, of course, whether they want to be able to do that. But in my research, every convenience store and grocery store that I went and started asking this about, they all accept EBT.
Okay, thank you.
Other questions from the committee? Representative Noor.
Thank you. May I inquire?
You may.
I don't know hardly where to start. I have so many questions. So a TANF card and a food stamp card are exactly the same?
Same card to access both styles of, both of those are money in two sort of different accounts, but they can be accessed through the same card.
But you can, and I've seen it myself personally, but you can take an EBT card and buy some food. And actually swipe it there at the counter and get cash back from the cashier. Or go to a machine and get cash back. Can't we just stop that cash back silliness?
That's what this bill hopes to do, yes.
Would it be hard to do? Because I don't understand all how you get pornography out of a card, but that's not my area, so I don't know. But would you get cash and then go buy the pornography somehow?
Right, yeah. Once you're given the cash, I mean, it's untraceable. You can do anything with it. Anything good or anything bad. And of course, I mean, there's only so much money to go around with it. I mean, this is for trying to help people get out of poverty and get back to self-sufficiency. So, yeah, we would want these funds used in the right way.
So we can use your bill just to stop them from getting cash back and buy only things that are approved as food items.
Correct. Well, food or, there's other things that are good. Like I said, diapers and clothes. And, there's on the TANF side, there's some worthwhile purchases there.
But a lot of people on food stamps don't get TANF.
Right. Those are two different qualifications, two different accounts. Sometimes a card will have access to only SNAP, which is food, only TANF, or sometimes both.
Okay, thank you, I think.
Okay.
Other questions? Other questions from the committee? Representative Remley.
Inquire.
You may.
Is there a restriction on how much cash a person can draw at one time?
The maximum that you have in your TANF account.
Representative Brown.
To inquire.
You may.
Thank you for bringing this forward. I have stories like this that I'm told by my constituents also. Not necessarily convenience stores, but gas stations where they also sell food and things. And the story that I remember when I was talking to people in the district was that children came in with a card and they bought $90 worth of stuff, and the healthiest thing they got was pizza. So that's not, this isn't going to stop that, but that's my goal, is to stop that.
There are many holes in the ship, and we'll plug them one at a time.
Thank you.
Representative Bratton, did you have a question? Representative Meredith.
Just very quickly,
Yes.
very quickly, if all of your money that you get comes from this card, and you have a kid who's going somewhere with their friends, and they need $5 or something, is there any way that there could be like a minimum amount of cash that they could get back? I mean,
Well, right now, they can acquire cash for all sorts of purposes to the fullest degree. As far as the bill goes, no, they would have to acquire cash in some other way. That's the only way we'd really be able to prevent the fraud.
I guess what I'm thinking is if there was a $10 limit, how do you pay your rent?
Well, that's up to where you live and your landlord and what payments that they would take. There's, of course, rent control situation. We already have other programs to kind of help reduce that.
Sometimes people, the situations arise where you just have to have just a little bit of cash. Because I know I carry very little cash. But sometimes you have to have just a little bit of cash. I mean, could there be like a minimum or maximum amount of cash they could get?
Well, it's it's how wide do you want to open the door? We'd like to have the door open wide enough to where only the purchases that's going to help someone get out of poverty are be able to be purchased. Those that would not, that would be kind of abusive or maybe kind of repeating the same mistakes in life, don't happen. If we open it wide enough to where you can get cash for anything that could be done like you're talking about, which you might be able to deem to be good, you're opening it pretty wide for a lot of the abuse that we've already seen, that we know already happens. And I don't think that this bill is going to basically make it to where you can't get cash just because it is just so abusable. Pretty much anything these days that's a product that you would buy is for sale at a store that takes credit cards, debit cards, and EBT, the food, clothes, and things like that. And you know, it may not be perfect, it may not be an ideal world, but I think this is a step in the right direction to getting rid of a lot of the fraud abuse we see now.
I'd just like to see some way to have somebody, like a small, very small amount be available. But
yeah, well, and there's work requirements that come with TANF, and so, you know, if they fulfill the work requirements and get an actual paycheck in addition to this, then they could, of course, cash, they can have a bank account and use cash.
I'm thinking of the 14-year-old kid that doesn't need to be embarrassed. Thank you.
Other questions, comments from the committee? Representative Bratton.
To inquire.
You may.
Gentlemen, first, you know, thank you for sponsoring a bill like this. Yeah, you know, the American taxpayer, you know, has had representatives and senators come together and enact, you know, charitable, you know, giving through the taxpayer, whether you agree or disagree. But I think the taxpayer is owed that the items in which and the programs in which they have enacted to help their fellow man that should remain to the scope of that program. And by allowing, you know, the cash redemption of the entitlement programs, I think is an abuse of that. And me as a person who works hard to give my kids and everything all that they have, I think that's what these programs were intended to help you get to that point where you could do that. But I don't think opening the door to allowing, you know, taking money out and utilizing it for any other thing other than what the intent was is good policy. And, you know, I think we need to help people. No, I think we individually need to help people, not you know, leave it to the government. But you know, I think provisions like this and ensuring up the abuse, because it's rampant. I mean, it's not just a small percentage; it's rampant. You know, I receive stuff from cashiers and things just like you have of the abuse they see each and every day with these programs. And I think anything we can do to help shore up that for the taxpayer and the money we're spending on these is just great. So I don't want to ramble on forever, but I just thank you for addressing this situation.
Representative Linsco, do you have some witnesses that you'd like to call, or okay?
No witnesses. Just the handout that I had from the fellow with the music community store manager. I've already passed that out.
Again, you know, we're kind of on the clock. Is there others that are in support of this legislation that would like to come forward? Anyone in support? All right. We'll go to opposition now. Those in opposition, if there be a witness.
No, it's all my colleagues, not at me. They want me to be first. Oh, lovely.
How are you? Thank you for coming today.
Jeanette Monoxer from Missouri. No one likes fraud, that's for sure. I don't either. But the truth is, people on TANF are very, very poor people. They wouldn't be on TANF if they weren't desperately poor. Our income guidelines haven't been changed since 1993, and our checks haven't been changed since 1993. We're talking about a benefit level that comes to 18% of the federal poverty level, a maximum of $292 a month for a family of 3. very few people on TANF actually do get subsidized rent. So many of them are paying a landlord somewhere, many of which do not have a way to be paid electronically. They often are paid with a money order or with cash, usually in partial payments, because a whole lot of people don't have enough to pay their rent for the month. And they're trying to put it together any way they can in order to get that rent paid. Most people on TANF are unbanked, other than the fact that they have an electronic benefits card, because banks generally require minimum balances that you're too poor to have when you're on TANF. A whole lot of folks on TANF do take some cash and go somewhere that sells money orders and purchase money orders to pay some of their bills with, and then mail those off, because it's the most cost-effective way for them to do some of their payments, in that they do not have gasoline to get around. They mostly do not own washers and dryers, so they go to public laundromats. It's impossible generally. I know that now we have some parking meters that you can put a credit card in, but we don't really have a widespread use of laundromats yet where you can do your laundry with an electronic card. People are too poor to go to a merchant often, even like a dollar store that would let you use your TANF cash to buy some clothes. They often buy at yard sales. Generally, yard sales, are the place you're going to get the most clothes for your money, and they do not take electronic benefits cards. When I buy my food at Aldi's, they always ask me if I want some cash back, and if I was a food stamp shopper and I bought my food with my SNAP card, you can't get cash that was meant for your food. You can only buy food with SNAP. But if I also had some TANF, I could get some cash back at Aldi's at that time. And often why I would do that is because I've had to have a neighbor bring me when they got off from work or whatever to get my food, because I don't have, very few places in the state have public transportation. So a whole lot of folks are begging for a ride and then giving the neighbor like $5 for gas. That's a reason that you might ask for some cash back. The situation for these desperately poor people on TANF is such that access to cash is important to their survival. We may wish that we could be Big Brother and look at every single moment of their life and make sure that they don't do anything wrong, but that's a really, really expensive surveillance system. We pretty much had to put some kind of computer chips in people and put something on money that lets us know whether that $5 that they bought some cigarettes with was really a $5 bill that Aunt Zelda gave them for their birthday, or did it come out of a TANF cash that they got sometimes earlier? To create something that would let us snoop into that carefully would be so expensive that we couldn't do much help, because we'd be spending all our money on fraud prevention. I think the thing is, if we see people that are doing something with their money that we are sure is not good for them or their children, we're actually going to have to love them enough to talk to them about it. That may sound like a really scary thing, but that's the real hope of correcting some of this, is we're going to have to say, brother, have you thought about what happens when you do that with your money? What happens to your kids? What happens to our community? We're going to have that kind of love that will interact with people, instead of trying to create a massive surveillance program that's not built on the reality that TANF clients are just desperately poor, and they need access to cash to get their work done, to get their survival done. We hope that you won't pass this bill, and that we'll all find the kind of compassion, that's kind of like my dad was about this guy named Sam who has to ask him to borrow money. And some of the guys from church would pick on Dad about that. And my dad told me, it's between me and God what I do when Sam asks me for money, and it's between Sam and God what he does with the money. Maybe we should all kind of have that kind of an attitude and love Sam enough to interact with him and help Sam make better choices.
Right. Thank you for your testimony. And I think that we all agree that there's not a person in here that desires to harm anyone, any poor person, or deprive them of any compassion, or in any way that we can help them in their circumstances. What we do find, though, is that the funds that the taxpayers, our taxpayer dollar that goes from me to them, goes from the state of Missouri to them, is used in abusive ways. And I think you agree with that.
Madam Chair, I understand what you're saying, and I am not accusing anyone in this committee of having any intent to hurt anyone who's poor. But whether we intend to do it or not, when we set policy that's not based on the reality of living in poverty, it hurts people, including children.
Right, and when people make decisions, and this is usually what happens in legislature, it just takes a few bad actors that causes the momentum for, you know, the closing in on benefits or actions or things that are available to, you know, to all of us.
Certainly those stories get
I'm
spread
interested
through the media.
Well, I'll tell you, I was
in a
at
mighty way. Yeah.
huge meat market, a butcher shop in our area, that I'm sure that these individuals had, however they had done it, they bought $700 worth of fresh meat out of the butcher shop with their EBT cards. Now that's pretty, you know, substantive. And I think that we see this kind of abuse, and then we want to know, what do we do about that? So I think that you have a pretty
I'm sorry,
close.
I missed it.
No,
What was
please.
abusive about it, please?
Is that they had that
Buying
much
fresh meat.
money, $700 on their card.
Oh, from one person? I'm not sure how that happened exactly, because
I
you usually
know.
spend it all in a month. There might be some
You
special
know,
circumstances.
exactly, and that is what we don't want to have happen. Someone that has the almost $300 on there, you know, those are the folks that we want to protect. But there are people who are abusive, and then to speak to the sponsors bill, you know, we don't want anyone purchasing these kinds of things with that available funding source. So we have to act in order to protect the ones, the truly poor, so that we do have enough money to help them, and possibly, I mean, raise that amount of money so that they don't have to live in this dire poverty if they need help from the state. So anyway.
I'll keep looking for solutions with you.
And
I really will.
you know what? I know that you do that, and I appreciate that. And you are willing to acknowledge that there are bad actors, that there is fraud.
In every single income bracket, there are people who are dishonest and who hurt people, yes.
Yes. So we're looking for those solutions, and
Zeal into those who are able to steal $6,000 a minute in our state of government money instead of those who steal $6,000 a year.
well, I think we could probably come back with one-liners, one after another, right here, okay? And it's probably not very constructive to what we're doing here. Okay. Other committee members with comments or questions? Seeing none. Thank you for your testimony. Are there others in opposition? And raise your hand if you're wanting to testify. Okay, well, we just have one after you. Is there anyone here for informational purposes only? Seeing none. All right, I'm going to put you on the 2-minute clock.
Thank you, Madam Chair, members of the committee. For the record, Colin Coble with the Missouri Coalition Against Domestic and Sexual Violence. We are just finalizing a point-in-time count done in March, one day in March this year. And the results are that 100% of those staying in a domestic violence shelter in the state of Missouri on one day in March are living below the federal poverty level or are TANF eligible. So those affected by House Bill 977 are my people, the nearly 35,000 women and children who are served by domestic violence shelters in the state of Missouri in 1 year. Much has already been presented that I would agree with. Our folks have to make some very difficult decisions in terms of their future safety. Is it that they gain enough income to be able to establish independent lives away from their abusers, or do they return? One of the largest obstacles is financial insecurity. These are people who will use their TANF cards to get cash, to pay first and last, and to pay rent, to pay for transportation, to pay for the school projects so their children can have a semblance of a normal life when they've been uprooted and put in another school. There are things that are purchased, with all due respect, that are not, and I quote, whiskey or meth or prostitutes. There are people in dire circumstances in our state who will be negatively affected when we focus on those who do wrong. I implore you to think of those who will be swept in and harmed and hurt. They're beat up, they're thrown away, they're those who didn't get what they needed when they were children in our foster care system.
Okay, let me ask you a question then. If we took the part out about cash back, would you be satisfied with the bill?
Yes.
Okay. If we made a limit of the cash back, so that kind of, an agreement between, so sorry, let's get into this funk. If we made a limit to the amount of cash back, would you be interested in doing that?
I think that would still be difficult to police given the range that you have in family sizes and the benefits that are relative to family size. You might have more emergencies or more need for cash in family to family to family.
Do you think that there's a problem? Do you recognize that there's a problem with getting cash back for some of the individuals on these programs?
There are some who misuse these dollars.
Do you have any ideas on how we can recognize that when it happens?
My thought is that if we move forward with some of the language that is in the TANF legislation that is now in conference, Senate Bill 24, that have some face-to-face contact again in terms of the relationship between a job training specialist and a person on TANF, that is a measure to be able to help a family that also has some compliance aspects of it. So I think there is an element of Senate Bill 24 that could do that. The last comment I would make is that in the bill language itself, I don't believe the phrasing is correct because it's specific to an automated teller machine for the use to make purchases. ATM cards aren't the legal terminology. That's not the machinery you use to make purchases. An ATM card is a term of art, ATM machine that is solely for deposits and cash back. It is not a purchase machine. So the language in here about not being able to use your cards to make purchases at ATMs is, I don't believe, in keeping with what the goal was, even if I disagree. But I think the language on the page doesn't reflect that. And I apologize for getting emotional about this.
Oh, no, that's all right. I appreciate it. It's just, we're going to run out of time.
It's really, really hard right now for a lot of families in Missouri, and I believe that we can do a much better job of connecting with them to support them in their journeys to self-sufficiency.
And I think, the intent of the legislature at this point is to do a better job for those folks who need that assistance. That's what we're trying to drill down to. All right, thank you. Please leave a witness form. Others in opposition.
Madam Chair, I'm Pat Doherty with Catholic Charities out of St. Louis. I'll be very brief because I think Colleen hit on a couple things. We have over 150,000 people in the 11 counties that we serve, and I'm told about 72 or 3% live below the poverty level, which includes a significant number of seniors in that number. What I want to say is, in order to address the abusers, which the language in the bill does, I think basically what you're doing is ending up, hurting those. And I want to go back to the phrase you used, I think very fairly was, you want the money to be used, I think you said, the right way towards self-sufficiency to get out of poverty. To address the abusers in such a wide range on that part related to the cash back, you're actually punishing the people who aren't using the money the right way to get towards self-sufficiency to poverty. Because, you and I know that it's TANF, T-A-N-F, the word family in there means kid. And you've got diapers, which you can't buy with SNAP, and a lot of places where you can or cannot use that card, you may need the cash to do that. You may need the cash for the bus fare, that you may need the cash for the personal hygiene items. Those are the types of things that actually people run into. Our goal is to help people out of poverty through Catholic Charities. And We try, and I think we do a pretty good job with the programs that we have. This, to me, would be punishing the people that are working to get themselves out of it by inordinately tightening down on something that you're trying to get to abusers, but when you get to the abusers, you're impacting the whole population. And that's what we're afraid of, because that would make sometimes our job a lot harder.
I understand. Thank you very much for your testimony. All right, do you have a closing statement? Wait. I saw a hand from the committee. Representative Brown, you're on the clock.
Yes, Representative.
To inquire.
Yes.
So my question is, if we had some kind of monitoring system that said, that triggered if they use more than X amount to get cash back, I mean, do people really only use the card to get cash back, or do they actually purchase things with it? Forget the SNAP, I'm talking about TANF.
To ask that part again, just.
Well, let me try and see if I can say it. Okay. If we found that a person was 100% of the money was being pulled out for cash, that would tell us one thing. But should we do some kind of monitoring like that so we can trigger and say, okay, look at these particular individuals because they're getting too much cash back?
Take it out.
Yeah. Would that work or not?
I don't know. I would be curious to know if other states have done this, realizing that the family size, the amount of money would be the trigger. I mean, because if you have, like 4 kids versus 1 kid, the amount of cash coming out shouldn't trigger whether you have 1 or so. Maybe somebody else has already done that. I think we'd have to be careful again because each family's circumstances.
Well, I didn't say that it would stop anything. It would monitor and trigger.
Understood.
There's someone else.
I am not aware that another state has done that, but I have not researched on it.
Thank you.
Sure.
All right, thank you. I know this has generated a couple more thoughts from the committee members. Representative Bratton.
So quiet.
Yes.
What do you believe is kind of the heart behind, I guess, the abuse of these systems? I mean, what do you think motivates a lot of people to abuse versus be grateful that they're receiving such assistance?
That's actually a good question. I don't really know.
I think it could be. Go ahead. Well, you think it could be that we've removed the face of a human being giving to another, and then we've replaced it with these lavish programs that become a way of life, and it's no longer charity, but it becomes an entitlement and that they're owed, and versus this is my neighbor through programs. This is
okay. Look, I think I would answer that in 2 ways. Number one, and you and I may differ on the word lavish, but I used to be a caseworker for family services back way before gray hair, and I was probably at least as tall as you were back then. And so I've had some experience in this many, many years ago. And the people I ran into then, there's this one person I recall, she says, I don't want your money. I know this is different than what you're talking about. She says, I cannot pay for my kids' medicines. That's all I want. All I want is somebody to help me because I don't have much money. And so I think there's an awful lot of good people out there. In the role of church, Catholic Charities, I think we must raise, whether it be from taking care of an abused kid or a shelter, and we have the seniors and kids who've been thrown out of their home and homeless people. We probably raise over $70 million a year. And a lot of that is one-on-one, face-to-face. Not always. People come into our many different offices, and we try to do that. And we try to help people get towards self-sufficiency. I would say most of the folks that we see are pretty broken in many ways, but some of them only need a little bit of help. And I think that's what we're there for. And TANF, somebody told me once that 67%, I could be wrong, are there less than 2 years anyway in terms of the TANF program. So if that's accurate, I don't know that we've got the majority of our life nowadays in the United States is it's an entitlement and people owe me and I don't have to work to get out of it. There are people like that, and we have to deal with those folks too. But I don't think that's the majority of the folks that we see. I don't think that's the majority of people's hearts. It's frustrating when we run into those folks, and I think we have to try harder. Right. Yeah, that's a fair question though.
Oh, and that's the thing that gets me, because I've sponsored a bill that limits certain types of foods, more of the expensive type foods, and And I guess the hate and discontent I get from people of saying, how dare you limit my money? You know, and that's been the overwhelming like email response that I get from people that are against. And I guess that's what I guess hurts my heart, but boggles my mind of the entitlement mentality and the venom, I guess, that comes out of any type of reform to these type of programs when they were instituted to help them, I guess, but not become so great as to become a way of life, I guess. And I think that's what we're trying to do here is find the balance.
I would end with just, I think the comment that Colleen had about that one element that's in 24, I'm not a super fan of 24, but that part about that face-to-face, even workers have said that will help us. And so I think that helps us to address an individual's needs and what's going on in their life that maybe we can help them to get out of either a mindset or maybe they've got mental issues too and you know, drug abuse and things but it's that one-on-one thing that we need more of. I don't see the culture of that. I get really frustrated when I see any of it. I don't see a culture, I just see the frustration of us trying to help people. But I hear what you're saying. I'm sorry about the venomous types of things that you get. I think we all get that when we file a bill that some people don't like. I can show you.
Thank you, I appreciate it.
Yeah, I hear you.
All right. Thank you very much for your testimony. Be sure to move a witness form. Do you have any closing comments, Representative?
Well, we're fairly short on time, so I'll kind of keep it brief to Representative Bratton's point and kind of to let everybody know about how often this really happens. According to the General Accounting Office, that's your federal government's kind of auditor there. In fraud, last year, 2013, they have estimated $2.7 billion in fraud in the SNAP program, $2.4 billion in the TANF, a total really all welfare type programs of $50.8 billion, which accounts for 8.1% of all of it that's spent. So it's not that this is an isolated thing. We don't want to hurt anybody that needs help. But like I say, if we have the door open too wide, you're just asking for a lot of funds that could go to help people that get wasted. So, and the fellow that wrote the thing that I passed out wanted me to let you know too, that prior to being a manager at a convenience store, he and his wife were on TANF, were on food stamps, and he used that program to get that job, work his way up to manager. So it kind of burns him a bit to see when folks don't use it the right way. With that, I'm done.
All right, thank you. That concludes the committee hearing on children and families. Thank you all very much.